Blood moving through the heart chambers creates heart sounds as the cardiac valves open and close during the cardiac cycle. The vibrations of these structures caused by blood flow produce audible noises. The more turbulent the blood flow, the more vibrations are produced. Blood flow turbulence is determined by the same variables that govern the turbulence of all fluids. These are the viscosity of the fluid, the density of the fluid, the velocity of the fluid, and the diameter of the column through which the fluid is going. Auscultation of heart sounds with a stethoscope is a foundational component of physical medical exams and a critical first-line technique for evaluating a patient. Some noises are extremely distinctive of substantial pathological lesions with considerable pathophysiological effects, and these are first detected on auscultation. These lesions might be heard in systole, diastole, or throughout the cardiac cycle. Heart sounds are produced by a specific cardiac event, such as the closure of a valve or the tensing of a chordae tendineae. Auscultation of the heart sounds can be used to diagnose a variety of pathologic cardiac diseases. Heart sounds, unlike a heart murmur, are discrete, short-duration auditory events caused by a specified reason. A murmur is caused by turbulence in blood flow and can sometimes span the entire systole or diastole cycle. The S1 and S2 heart sounds are the most common normal heart sounds. S3 can be benign at times, but it can also be pathogenic. A pathologic S4 heart sound is almost always present. The intensity, tone, position, quality, and timing of heart sounds in the cardiac cycle can all be used to describe them. Let's learn about the characteristics of heart sound. Intensity. Heart sounds can be described as increased, loud, decreased, soft, or missing depending on their strength. Pitch. The pitch of heart sounds can be regarded as high heard best with the diaphragm of the stethoscope. Location. The etiology can be determined by the position of the heart sound. Both cardiac sounds and murmurs can be detected using the conventional listening posts, aortic, pulmonic, tricuspid, and mitral. The S1 heart sound, which is made up of the closure of the mitral and tricuspid valves, can be heard best at the tricuspid or left lower sternal border and mitral listening posts. Let's see the timing. Early, mid, or late systole or early, mid, or late diastole might be used to define the time. Although phrases like click, snap, and knock are occasionally employed, they have no particular meaning or characteristic. They will be referred to in the parts that follow.